Hello, and welcome all. I'm Josh Stevens, and I'm sitting here with Cara, about to discuss whether 100% latex-free hospitals are really the future. Welcome back.
Thank you for having me again, Josh. So, I'm Cara, midwife, previously in the NHS, and I'm looking forward to this chat.
Thanks, Cara. So, previously we were discussing and going into how risk for mothers, babies, and healthcare workers, particularly around latex allergies. Is it truly viable, do you think, for hospitals to be latex-free? And particularly, you're talking about gloves being one of the main causes, non-latex gloves being what's used.
Yeah, I mean, when you look at, obviously it's very simple to sit here and say, this is the answer, but we know there's a lot more to it. But when you look at how closely maternity and paediatrics are linked, I think across the board, when you're looking at mother and baby, it's such a simple solution that literally just mitigates such a huge risk to those two groups that I think that people don't often see the deeper inner workings of what a transition like this would do in terms of patient safety, not to mention healthcare worker safety. And I think on the surface, it's very simple. I know it's much deeper rooted and there's a lot more to it, but effectively, it is a very simple change.
So I've worked in the glove industry, so know people can get very emotionally invested in what they put on their hands. Do you see as viable as being able to move the department? I mean, you've worked in it.
Yeah, and I'll be completely honest with you, Josh. I've never thought about what I've put on my hands, ever. I've picked up a pair of gloves and I've put them on, and that's as far as I have thought previously. Luckily for me, where I worked, it was a latex-free glove environment, and maybe that's why I've never thought about it. However, when
You're one of the lucky ones.
Yeah, absolutely. But when the things that I've said, the statistics and the risks that were involved, when you look at those things and you see how potentially huge these implications can be, I think it is a viable option.
Quite often looking to be the only option if we're wanting to deliver that.
Absolutely. And like I said previously, when you look at the tools of your trade, so, for a midwife, the tools of our trade, it's our ears, our brain, our hands. Yeah. And when you're literally sitting there and thinking about the potential harm that you can be causing to somebody just by simply doing what you intend to be the safest thing, and it isn't, that opens up a whole can of worms.
Yeah. But one of the challenges is, and I know this is the price. We know hospitals and healthcare are in a really tough spot today. And this is true across Europe.
Absolutely.
And I know if you move from a natural rubber latex surgical glove, purchasing a non-latex glove, you'll be spending probably double. And in some countries and some manufacturers, it could be triple. So it's a huge price difference.
Yeah.
But then you were sort of speaking about it in that earlier conversation. There's a lot that goes into what a latex allergic patient does to your process. What considerations do you need to take?
Okay, so let's look at, you've mentioned price, okay? And that's always going to be the biggest factor when it comes to anybody who's not clinical, for instance, okay? But let's look at the price. But then let's look at the cost, because the price and the cost are two different things. Let's face it, you've got something that costs X amount, but then when you've got a whole other range of impact in there. So, for instance, you could be looking at a healthcare worker who has developed contact dermatitis, who goes on to develop a type 4 allergy, who goes on to be off sick from work. Now, most NHS hospitals run the policy of, sick leave is full pay, 6 months, okay? So you're paying a member of staff to be off sick while they're having investigations for a skin condition. So you're paying a full-time wage or a full paid wage to that person for zero productivity. You've then got the added cost on top of that of investigations, patch testing, prescribed hand wash, prescribed creams, particular styles of gloves that will suit them and whatever their allergy is. And then on top of that, you're having to replace that member of staff to get your productivity back up. So you're now paying another member of staff at a higher rate of possibly a bank rate or an agency rate. And then you've got the other aspect of that you're bringing in somebody who might not know the area very well. There could be implications with that as well. So that's just one tiny little element.
How are we ever going to get healthcare workers' salaries to rise at the same rate as inflation if
well, this is a question for the House of Commons. But yeah, I mean, that is just one. That's just one element. That's just from a healthcare worker's perspective and the costs that are involved with that member of staff being off with, a skin condition. And that's just one aspect. You've got a whole other aspect in terms of patient care or productivity within the unit. If you can't replace that member of staff, you've got to move other members of staff from different wards that then have less productivity because they've moved that member of staff. You might have exposure in theatre, for instance, where the patient has an allergic reaction in theatre, and then you've got equipment that's been exposed, and it might be disposable, so you've lost that kit, or it might need to go back and it might need to be cleaned and re-sterilised, and you've lost that time there, plus an extra expense, plus the actual fact that the theatre has to be closed down and deep cleaned.
So you're saying this is happening when there's a latex exposure to this equipment or to this room, and this happens you just open a pair of gloves in the same vicinity?
I mean, particles can be airborne, and if somebody has a severe latex allergy, if they are inhaling particles, that can be very, very, very severe.
So you've also mentioned just then about the loss of productivity. Mm-hmm. And so when you're talking about the loss of productivity, it's not just the staff actually being away, it's also the staff that are still there, but having to take on sort of more complex workloads of having to handle
moving areas. You might have a member of staff that's brought in from, community or birth centre or wherever they can pull a member of staff from to a place where it's needed more. And that doesn't do great for staff morale either, to be pulled from pillar to post or moved from an area that you're familiar with to an unfamiliar area. So you then have the added element of, staff dissatisfaction. So it's not just the monetary cost that's involved. You're talking about staff well-being and happiness, and as well as productivity and financial.
I mean, and you mentioned there staff wellbeing. You're just talking about staff wellbeing with all of the changes, not even touching on whether or not they're being protected. And the wellbeing.
Yeah, absolutely. And like I've said previously, we are far less likely to report skin conditions because we're aware of the stresses that our department are already under that we don't want to add to it.
Sort of going along the same thread, and you're talking about sort of with this product, you also mentioned having to clean rooms and things. So how does that have an impact? Does that mean if a theatre or a room or a ward has to be cleaned down because of the latex exposure and you've got a latex allergic patient, does that then block it up? Does that block up
you've effectively taken that out of action entirely. So you might have a room or a theatre that is now not able to be used until it's been cleaned down. Not to mention the member of staff that now has to look after the patient who's had a reaction. And that could be putting extra stresses on other areas of hospital. For instance, they might have gone to maternity HDU to be looked after. So you've now got unanticipated case going to maternity HDU. And if they can't facilitate, they might have to go to main HDU. So again, you're adding extra pressures onto other areas.
Sounds like it's compounding. Because early on you were saying, the staff could be off. So you could have less staff to begin with, but then you could also have less rooms available.
Yes.
And so then it's becoming a bottleneck of just higher and higher pressure.
Absolutely.
And impacting effectively the patients actually being treated.
Yes. Yeah. I mean, other areas mostly all feed into one area. So in maternity, you've got women that are pregnant, you've got women that are giving birth, and you've got women that have had their baby and need care afterwards. But it is like a system that all filters. So you've got community, you've got antenatal ward, and you've got triage that are all feeding into the labour ward, delivery suite, birth centre. They're all filtering in from all of these different areas into one area. And when you're putting extra pressure into that one area. You're then having to borrow staff from other areas. You're having to find room. You're having to, move people around. And if you've got a blocked room, you might have people that are waiting to come over from antenatal ward because they've had an induction of labour and they're ready to come over, but you haven't got a room to provide them with. So therefore, you're blocking them from coming over. So you've then got patient dissatisfaction, which can lead to complaints. You've got patients that are not happy with their care because they've been told they're going somewhere and now they can't because that room is blocked and they're not able to go, and they're in distress and their family is distressed, and these complaints are coming out, and it's all ongoing.
And so this then really what you're suggesting is it becomes bigger than just the workers at the hospital that are clinicians, but it has an impact then on who's organising everything, who's planning on who's flowing into which room to which ward, and dealing with patients coming in.
Yeah. I mean, it's a huge process of navigating and prioritising patients who are moving through maternity services, whether that's a planned caesarean or whether it's an induction of labour or whether it's somebody coming in because they've gone into labour at home. You're constantly evaluating and prioritising and making room and staff available all the time to then have the added pressure of this unprecedented event on top of all of these things to throw in the mix of having to navigate what staff are going where and what woman is going where and who's giving birth and who needs this more. And then with an unplanned event such as a reaction, it's huge.
So there was a really interesting comment you made earlier as well. You said price and cost are two different things. And so the price would be increased, as I mentioned earlier, moving to non-latex. But this cost, you're listing all these different things that there's a cost to all of this.
Yeah.
There's a cost, there's the monetary cost, but there's also the time cost, the resource cost, the people cost.
Yeah.
All of the different things and as soon as one of them is impacted, it impacts all the others.
It does, massively. And, when we've talked about staff well-being and staff satisfaction, all of these other things that impact onto a stressful environment, you've got that cost to add in too of staff satisfaction and, staff reward and workplace satisfaction. And these are things that you can't put a price on. And when you've got a happy workforce that is working well, you can't put a price on that.
No, not at all. It's sort of suggesting something like a mindset that's we're really going to change the healthcare system into what are we actually transacting on? Where is the true value? What actually matters? What's actually going to drive the best patient outcomes and staff well-being? Yeah,
because, at the end of the day, that all comes into it. And it's, okay, it sounds really dramatic to say this one little change will make everybody happy. It might not make everybody happy, but it would definitely make everybody safer. And I think when you eliminate that risk, when you take away that danger and the risk and the potential of a severe reaction and outcome, once you've eliminated that, then that cost really does show what a difference it makes when you've got such a simple procedure in place, because you've got staff that don't have to think about reading a latex allergy guideline and wheeling out a latex-free trolley for one person and making sure that information is handed over and they've got the red wristband on for the latex and it's written on their notes for latex allergy. You can literally free up that mind space to serve it better elsewhere.
And this ties into what you were speaking about earlier about how complex everything working in maternity is, but also how interdependent and interrelated it is. So to simplify it is to help deliver that better patient outcomes.
Absolutely. And I think that is the key thing to take away.
I mean, very clear to me. Go latex-free.
Absolutely.
All right, that's brilliant, Cara. I really appreciate the time.
Thank you.